diabetes and get some kidney disease in there as much as we can. So, as everyone may know, diabetes is an issue with your body handling sugar, and it's various types of diabetes. The main ones would be type 1 and type 2 that you know the most of or have heard of. So when you have type 1 diabetes, that means that your body is unable to make insulin at all, can't make it at all, and so all of those patients have to have insulin from the time they are diagnosed. Whereas type 2 diabetes, that's the one that most people get, definitely most adults. Some kids can also have that type of diabetes. And that one is more of an issue of your body responding to the insulin that you make, and what goes on with that. So anyway, with diabetes, like I said, it's a problem with blood sugar. And normally what happens when you eat, say, your body breaks down the food and the sugar gets absorbed from the intestines into your bloodstream, and your body makes insulin. It releases the insulin when you eat. So the insulin attaches itself to the sugar, and it goes to a cell in your body so that the sugar can go inside the cell can use the sugar for energy. So that's what's supposed to happen. When you have diabetes, type 2 diabetes, your body is not responding as well to the insulin, so we call that insulin resistance. And so initially our body can compensate with that by making more insulin, so pushing more insulin out, more than you otherwise would need, so that to try to get the sugar inside the cell. And your body does a good job of that for a while. But after years of doing that, it can't keep up. And so then your blood sugars, the level of the sugar in your blood rises. And when you have a high amount of sugar in the blood, it causes damage to the cells in the blood, blood vessel and other places. Circulatory system, the nervous system, everywhere. Everywhere that blood goes, and everywhere that the high blood glucose, which is the name of the sugar in the blood, everywhere the blood goes, it can cause damage. So that's why so many different complications that can happen with diabetes is because the sugar goes everywhere, and so the damage can be everywhere. So our goal is always to, number one, get us to recognize early when we're starting to have the problem with our body handling the blood sugar, and to make lifestyle changes in addition to either medications to get the blood sugar to be lower so that you won't have all the complications from the high blood sugar. So as far as the complications for diabetes are concerned, like I said, it's a lot. So some of the main ones I'm sure you know about is your eyes. So one of the more common reasons for vision loss is diabetes, uncontrolled diabetes. You can also have issues going on with your heart, right? So when you have high blood sugars, that puts you more at risk for cardiovascular disease, all the umbrella of what that includes. So that means heart attacks, problems with the circulation, you can get heart failure, all of that kind of stuff can be because your blood sugars have been too high for a long period of time.
Also, your nerves, when you have high blood sugars, that puts you more at risk for cardiovascular disease, all the umbrella of what that includes. So that means heart attacks, problems with the circulation, you can get heart failure, all of that kind of stuff can be because your blood sugars have been too high for a long period of time. Also, your nerves
can be affected by the high blood sugar, and so people can get what they call a neuropathy or peripheral neuropathy. So a lot of times it starts at your feet and can work its way up to where you have numbness, tingling, burning sensations. You get to the point where you have difficulty walking because the nerves have been affected by the diabetes. The diabetes can also affect the kidneys, which we were talking about a little bit. Kidney disease, one of the main reasons for people going on dialysis in this country is diabetes. It's from diabetes. Now, we'll get further into other reasons for kidney problems, but diabetes is one of the main reasons, like I said, in this country for kidney failure. High blood pressure and diabetes puts you at risk for a stroke, right? So when we talk about cardiovascular complications of diabetes, stroke is one of those. And because basically the issue is with the blood vessels, and it's the location is just in the brain, and so that's why it's a stroke, as opposed to the location being around your heart, and then you get the heart attack.
It's a blood clot.
So that's one of the things. The stroke, so diabetes again damages the blood vessels. So if it's damaging the blood vessel in the brain, it can cause a narrowing of the blood vessel. So the opening of the blood vessel gets less and less and less until the point where it closes off altogether. That's when you have the stroke. So it can do that, and actually high blood pressure can do that also, but it's because of the pressure, and this one is because the glucose damage. And then when you have both high blood pressure and diabetes together, your risk is even higher for that kind of thing to happen. So, that's why when we see that somebody has diabetes, we are also trying to make sure that their blood pressure is not too high, making sure that it's normal, because again, both situations can cause the stroke or any cardiovascular complication. Both of them are risk factors for heart attack, for peripheral vascular disease, for kidney disease, because that would be the reason why you get the kidney disease is the blood vessels going to the kidneys get damaged from either the high blood pressure or the diabetes. And your kidneys need a lot of blood flow, right? Because it's filtering the blood, so it needs a lot of blood flow. And when you start getting the complications of either diabetes or high blood pressure, again, you can get narrowing of the blood vessels, and it's decreasing the blood flow to the kidneys, and then that's when you start having more problems. Yes. In addition to, like I said before, diabetes damages the cells also, so not just the blood vessels, but it can start damaging the cells of the kidney. So, yes.
Are any of the conditions that you spoke on, like the neuropathy of the feet or the hands, and perhaps your blood vessels narrowing, are they reversible?
Yes, so I would say it up to a point. So when you start having diabetes, obviously we try to get things controlled as soon as possible. Once you start having some of the symptoms of say the neuropathy at the very beginning, it is possible for reversing, but if it's prolonged symptoms, meaning years, then trying to get it completely reversed is probably not likely. You can get improvement, but you might not be able to get complete reversibility because it's too much damage has happened, right? So that's why, again, we try to catch things in the early stage, it's just a little bit of problem has happened, we reverse the situation, then you can sometimes get complete reversibility, all symptoms gone, that kind of thing. So you can do that in early stages, once the complications have just started maybe. But if it's been there for a while, then no, it's just more of a managing the symptoms at that point.
It's various causes of kidney disease. Like I said before, some of the more common reasons would be uncontrolled high blood pressure for long periods of time, or diabetes that's uncontrolled for long periods of time. But there are other reasons also. And there's autoimmune conditions that cause it. There's, it's just a lot of different reasons. It can just develop on its own for whatever reason. So when we are checking your kidney function, we usually can do it two different ways, through the blood and checking through the urine. The urine would be, we're looking for protein in your urine, because it shouldn't be any protein. If your kidneys are working well, they prevent protein from going into the urine. So if the kidney, if we start seeing protein, especially if we start seeing it on a regular basis, then that means something is going on with the kidneys, because it's not working as well as they should prevent the protein from getting in the urine. For the blood test, that is the BUN, which is blood urea nitrogen, and a creatinine test. We usually do those tests together to give us an idea the functioning of your kidneys. The creatinine test in general should be less than 1. So once it's over 1, especially significantly over 1, then that usually means that your kidneys are not working as well as they should. And then you start getting into the various stages of kidney disease, chronic kidney disease, CKD. So there's 5 stages. 1, 2, 3, 4, 5 means you're on dialysis. So sometimes it can be mild. Now, one thing, when we're doing the blood test, if you are not well hydrated, meaning you haven't had much fluid that day, then your kidney function is going to look a little worse than what it otherwise would. So that's one of the reasons why we try to give patients to, drink plenty of fluids, so that we can get an accurate reading of their kidneys. So sometimes if it's just mild, then we'll have you repeat the test to see if that was related to just maybe you weren't hydrated well on that day that you had the blood draw. But yeah, so it kind of depends. Sometimes if you have an incident, say, that causes your blood pressure to shoot up real high, 200 over whatever, when it is not normally that will cause acute damage to your kidneys. And so you could have been good, and then all of a sudden there's some damage that has happened, and so you're not going to be where you were before. Now, can you get improvement? Yes. Some. Again, it depends on how bad it was and how long it lasted, whether you can expect much improvement with when your kidney function gets bad. But yes, you can get improvement. Whenever somebody starts to getting abnormal tests with their kidneys, we try to make sure that they're taking their medications like they're supposed to, because sometimes people like to take extra because it wasn't working. Like they took Motrin and you're supposed to take 1. Well, it wasn't working with that. Let them take 2 or 3 or because that could damage your kidneys. So we try to review medications. We sometimes will do a ultrasound to make sure that it doesn't look like you have a blockage, say, in your urethra or your ureter. because that will cause the kidney function to be abnormal. If they fix that, then you'll be good. So we try to look for reasons why it could be abnormal, and then try to fix that as best we can. So yes, if your blood pressures have been high a lot, that can cause you to develop kidney disease. Getting the blood pressure under control could get some improvement. You have to see, because it depends on how long it had been high or not well controlled. If it was a long time, then more than likely you're not going to get improvement by getting the blood pressure under control. We still try to get the blood pressure under control because we want things to not get worse. So if you get to stage 3, say, but now we get the blood pressure or the blood sugar under control, then we can stay there, and then that's fine. And that might be mild adjustment with how you take certain medications, but otherwise you can do fine after that. But we try to prevent things from continuing to the stage 5 if possible. So if the blood sugars have been not well controlled, or you had, sometimes people have episodes with the blood sugar, you do okay, and then all of a sudden it gets super high. Again, that's an event that can cause a lot of damage in a short period of time. And so that's how you can jump up. Your numbers can jump up quickly. So kidney disease is main thing we try to do is try to find the source or the reason why the kidneys are doing bad. So like I said before, if it's blood pressure, get the blood pressure under control. If it's the blood sugar, get the blood sugar under control. If you have developed some type of autoimmune condition, sometimes steroids are involved to get things under control, and then on other medications for maintenance. So we try to get the reason why, so that we can get the correct medication to prevent further deterioration of the kidneys. But sometimes, it depends on what the medical problem is. It may not be possible to prevent it altogether. And so if you continue to have problems, once you get to stage 4, then the nephrologist usually is trying to get you ready for possible dialysis. It's 2 different types of dialysis. There's hemodialysis. That's the one where you go 3 times a week to the dialysis center, and you have a graft either on the arm or some kind of catheter in a big artery, and they're cycling the blood out, and they're filtering it just like the kidneys would. The kidneys filter the blood and get rid of the waste, right? Get rid of excess, whatever. So if your kidneys are not working, they can't do that. And so that's what the dialysis machine does. It filters all of the waste out and the stuff that you don't need out, excess potassium, excess whatever. It gets rid of all that kind of stuff. And it takes a long period of time, usually 3 hours or so. It's an extended, it's just a lot to it. But if you need it, you need it, because it's gonna keep you alive.
Foster did an excellent job.
Yes.
We give her a big round of applause. She did an excellent job as always every time she comes. But out of everything that she just spoke to about us, we need to know where we stand. And if we don't do our preventative care, and I have flyers 55 and up, 55 and under, I can't tell you guys ages because you all look wonderful, but you have to seek your healthcare professional, which in this case is Dr. Foster. So the A1C, the diabetes, the kidneys, the high blood pressure, the cholesterol, everything she's talking about, you have to go to the doctor. I'm never gonna kick holistic. We need holistic because things worked before we were going to doctors. So some of you guys are from the South like me, things are working before we went to doctors because we didn't have the doctors. But God gave us doctors and gave them education to help us. So in knowing that, we have to go to the doctors and we have to hear what the doctors are saying, but we have to also trust the doctors. Everything Dr. Foster was talking about, we have to monitor those things. We just can't get it and say, I don't wanna try it, it's not working, I don't like how it tastes, I don't wanna inject anything. We have to monitor that, and everything in moderation. So if you can please see me, because we wanna push preventative care at DMC, especially DMC Sinai Grace. We want to make sure you guys have a relationship with your primary care doctor, because that's where it starts. And you have to be transparent. If you're gonna do holistic and medical, you gotta let your doctor know. If you're not taking a pill twice a day, 3 times a day, or however it's ordered, you gotta let your doctor know. Because if not, then they're gonna add more medications to something you're already not doing. So the key to success is prevention, but preventative care services. If we're gonna take care of our house, we're gonna take care of our clothes, we're gonna take care of our car, our biggest investment is us. And we have to take care of us and each other. So please see me, whether you need the information or not, share it, because we need to take care of each other. The Bible tells us we perish for a lack of knowledge. And what Dr. Foster just came in here and did, you can't get this anywhere.
Right.
And that's what makes the DMC special. They're providing doctors to come and talk to you all, us, everyone in the community, in all settings where you can ask those one-on-one questions. You can't get this anywhere. So take advantage of it. Yes.
You